During the last decade, we have learned that overall health, including digestive and mental health, is associated with rich and diverse microbiota, and that patients with psychiatric disorders have different microbiome profiles and microbial metabolism. We don't know the exact mechanism through which the microbiome induces anxiety and depression, and in which patients this happens. We, however, do know that a well-balanced diet is associated with a rich and diverse microbiome. Thus, it is likely that improving our dietary habits will positively impact our mental health. And in addition, we have already identified several probiotic bacteria which have beneficial effect on brain functions, and thus it is possible that in years to come we will have new microbiota-based therapies for patients with mental health disorders. We have advanced significantly in our knowledge on the microbiota gut-brain axis, on how gut bacteria communicate with our brain. 10 years ago, most data were coming from animal studies, which demonstrated, for example, that germ-free mice behave differently from conventionally raised mice, that means mice with a normal microbiome, and that their brain chemistry also differs. Now, 10 years later, we have learned that gut bacteria in patients with anxiety and depression differ from those in healthy individuals. And when we transplant these bacteria to germ-free mice, they induce anxiety and depression-like behavior, which is suggestive of their causality. Furthermore, multiple clinical studies have explored the therapeutic potential of probiotics, and they found that probiotics may improve depression symptoms, although the effects on anxiety are not so encouraging. However, despite all this significant progress we have made during the last decade, we are still not at the stage where we would be able to use this knowledge in clinical practice, but I am optimistic and I hope we will get there in next 10 years.